In our first story, the National Peace Council is lamenting it is not getting the desired cooperation from the political parties in the attainment of electoral peace. Now, speaking to Joy News, the Bono Regional Executive Secretary of the National Peace Council, Swala Abdallah Kwanda, says as a non-prosecutorial body, it could only continue its engagement with parties and other stakeholders in the drive to hold on to the peace the country is enjoying.
Peace building or peace work is a collective responsibility. You cannot force peace on people. So if people decide not to cooperate with you, it is very difficult for you to be able to facilitate the peace that you do. If you look at the underlying factors of all this violence in this election registration period, people busing people from different constituency to a constituency that they do not belong to. And they know it's against the law. But which people are doing it? It's the political parties. They are behind it. So are they cooperating? There is an arrangement or mechanism that if somebody is going to register and you do not agree, you suspect the person is not qualified to register, there is a process that you go through. You don't force the person out of the queue. The political parties have decided to disregard this mechanism. These are all things that we expect the political parties to know and adhere to. So if they don't do that, the best we can do is to continue talking, continue discussing with them, continue appealing to their conscience, continue appealing to their emotions, for them to appreciate the fact that what they are doing is not in the interest of peace. The political parties, yes, we are not saying that they are giving us problems, but they are not cooperating as we want them to cooperate.
Away from this, no, she was one of the frontline workers who dealt with Ghana's initial cases of COVID-19. But the numbers since have increased and now require more than what any health worker was prepared to give at the time. Evelyn Naki Dowona soon left her home to take up residence at the Ga East Municipal Hospital. This meant leaving behind her own mom and her 9-year-old son. Now here's a story about a mother and a health worker on the front line.
Hello. Yes, how are you?
I'm fine, Mom.
A tired mother looks straight at the electronic device before her. She laughs. The tablet is the safest way to touch base with family, but keep her distance as she works to save lives. Evelyn Naki Dowona is Quality and Safety Manager, Infection, Prevention and Control at the Ga East Municipal Hospital. Her job involves ensuring that the facility meets world standards in treating COVID-19 patients. Over 400 patients have been here in the past 5 months with an encouraging rate of recovery. Evelyn is a mother of a 9-year-old who has always been close to his mother.
I've missed you.
Yes, I miss you too.
Evelyn has been living in a facility provided by the hospital for the past 5 months, sacrificing family time on her patients.
I moved in for the ending of beginning of March, and so I have to put in a whole lot. I haven't been able to go. I was able to go home once. We do a lot of WhatsApp call, video call to see them and talk. But if I had to go do something, my mom wants to see me. So he has a way of saying it. I bought something for you because you're not able to go to the market. Come for this nice dress, come for this shoe. Just ask permission and go and see them. They was like, oh, won't you sleep for today? No, my job doesn't mean I should sleep.
And with rising cases of coronavirus, she barely has time for anything else.
At times I even forget to eat. So one of them who has taken the responsibility, madam, you haven't eaten. Then just give me a reminder.
She thanks God for the staff of the Ga East Hospital who look out for each other within the period.
They are my deputies, I will say that. And so they've actually been able to man the front. And so I just get, instead of reporting at 6 a.m., I now come at 8:30. They've really helped me a lot, and I cannot do without them. And I say big thank you to them.
But her biggest motivation is little Emmanuel Anan, her son, living with her own mother, whom she checks up on from time to time. The love keeps her strong. The little boy's understanding of his mother's duties keeps her sane at such a period when she sacrifices to aid Ghana combat COVID-19.
I hope the president will want whatever you are doing and appreciate you.
Oh, okay. They were here, okay? But you have to stay safe for me, okay? And put on, well, use your sanitizer often, okay? I will stay safe. You to stay safe, okay?
PSC Nanaya Osafo, Joy News.
Bye.
And also related to this, but this is our last story. Kumasi-based educationist Theodosia Jackson now is drawing attention to what she observes is relaxation of measures to contain the spread of COVID-19. She's also worried people continue to flout the protocols with so much impunity despite increasing confirmed cases. Mrs. Jackson, who is principal of Jackson College of Education, now wants stringent measures introduced during a partial lockdown revisited. Mohammed Nuruddin now brings us the story.
The college is on a nationwide campaign to combat the COVID-19 pandemic in Ghana as a social responsibility initiative.
COVID, go away! COVID, go away! COVID, go away!
It is collaborating with Sinapi Aba Savings and Loans on the project launch in Kumasi with a call on government to intensify efforts to contain the virus.
This COVID spread is attitudinal, character, behavior, the way and manner we behave. It bothers me so much when I hear in my ears that COVID has come to stay. So I keep on asking myself, am I going to wear this mask for how long? Over 70 years. And if Almighty will add 30 to the 70, am I supposed to wear this anywhere I go?
She says it is unfair for section of the population to disregard the protocols and endanger the lives of law-abiding citizens.
I just want to draw the government's attention this morning. We are very serious here. When you even go to church, they take your temperature. They give you forms to fill to indicate where you will sit. You wash your hands, go through all the protocols before you enter. The people who go through all these protocols, where have they come from? They are the very people at the market. COVID had made some people gain in their businesses. And as I stand here on behalf of all private schools, we have lost so much. We can't even pay our workers. Children are at home. Shall we misbehave and look on for children to remain at home? In future, where will be our doctors, our nurses, and even the president? COVID, go away. Attitudinal behavior, character. Some people, it baffles me when they say that we should bring those who have died on TV before they believe. Do we bring those who have died because of malaria fever? Do we showcase those who have died because of cancer? Do we showcase those who have died because of AIDS? Why do you do things this way?
Well, insightful education right there. But that's it. The latest news updates we do have. But I have to say a very good morning to Nanaya Jemfikesi. You're the Acting General Manager for Road Safety Management Services Limited. And I wish you all the best for the day. But we're taking a break. When we come back, we'll do review of the newspapers. Do stay with us. Good morning to you.
Good morning. I love that Corona education story with all the placards.
You did?
Yes, absolutely.
That was our last story.
Yes, it was.
I think it was with the Jackson College of Education.
You know, we need to do a lot more of these to get the message to the... when the woman said, I'm going to be wearing the mask for like how long? You know, how long can we survive living like this when you can't even see people's faces?
I have a friend, Mr. Jabba, who works with Stanbic Bank based in Bolga. And he was just giving me a message when that story was ongoing about how it looks like now, even that the cases are up, we don't care at all. When the cases were 2 and 12, we were all scared. And now it looks like we're all just flouting the protocols. Yeah.
Well, let's say good morning to Gifty and Apia and Joseph Akablate, our colleagues joining us.
Hi, good morning. I was just going to say, Roland, that, you know, the way we react to coronavirus right now is just like how men behave towards their wives after many years.
Yeah.
We get used to them.
I think that we all have daily discussion. You know, the first time when we encounter the women, well, oh, have you eaten?
They're checking on you.
Wait, Jerry. And apart, you know, they do video calls and all that.
But you know what you do?
I read something.
Oh no, I'm telling you the reality. I'm a man, so I know how it goes.
What happens when a relationship is coming to end? I'm told the man says, hold on, I'm closing the fridge to come.
That's a funny one, but that's the reality, you know. We all seem to be very much hyped up and very enthusiastic for first timers.
Roland knows it all. I think he's
I think you and I have been through the process. And Gifty to us,
many more years.
Given all the things that she's also experienced, she knows that's how it is. So
excuse me. I'm sure, anyway, we don't have time.
I'm sure right now she'll just tell you.
We don't have time. We don't have time.
I'm sure right now she'll just tell you, Massa, go straight to the point. At the end, oh, the way you're laughing, you know it's true. Oh, Gifty, thank you for the confirmation.
So I don't waste time.
Okay, listen.
For the next 10 minutes,
we've got a very limited time, so let's shoot straight away. Gifty, let's start with you.
Okay, I have the BNFT right here, and the banner headline for the BNFT says, jobs, livelihoods hinge on diligent implementation of CARES. That's according to the TUC. The story is on page 3, and Mama B, if we have some time, I hope you'll be able to read for me that, what's it called, the first paragraph. I just want to have an idea what that, right. And then I have here also, 2 out of every 5 Ghanaians are poor. That's according to GSS. It looks like a survey that has been done, and really sad in the 21st century that still 2 out of every 5 Ghanaians are poor. And then post-COVID-19 economy's growth rate is below potential. That's according to the IEA, and President Akufo-Addo cuts short for Tamale water project. Very exciting news. That is part of the Yendi development agenda ongoing right there. So let me see, right beneath the banner headline, you have a story. Who is there? Okay, it's a bit difficult to see, but you can grab yourself a copy of the BNFT. I'm going to take you through the inside pages. So you have details of the story on jobs, livelihoods hinging on diligent implementation. That's a TUC. You have that story on page 3, and President Akufo-Addo's cutting the sword for the water project in Yendi, also there on that page. Then the story post-COVID-19 economy also there as well. Other pages, you have move away from banks of Odo or face eviction, according to the Accra Mayor. Accra Mayor is telling those who live along the banks of the Odo River there. And KGL Technology receives NLA licenses to operate digital lottery products. And 2 out of every Ghanaians are poor. That story is on page 2 of the BNFT newspaper. Let's see what we have on the back page of the BNFT is West Hills Malls Food Courts raises the bar, Stanbic digitizes banking service request for clients. Of course, it's a business newspaper. You should respect some of these stories there. Let me see, I only have the front page of the Finder newspaper. I'll go through it anyway. And the banner headline is 223 million Tamale water project takes off. It will benefit 792,000 people, according to President Akufo-Addo. Comes with a picture of the president cutting the sword. And COVID-19 initiative, splendid, according to TUC. So I think that's the CARES project there. It commits, so TUC commits to help governments implement the program, and that story is on page 2. Magdan donates 3 hemodialysis machines to 37 military hospital. The story is on page 3 of the Finder newspaper. So that's all I have for now. Mama B and Roland Akable.
All right, let's go to Joseph. Joseph.
So I'll start with the front page of the Dispatch. It has this story about launch of Professor Hoy's book on Rollins. It's on the front page. Another story here says KGL Technology, gets NA licenses to operate. And stop pussyfooting, bring your evidence is also on the front page. And Rollins' close associates replies him again. Details of that story in the Daily Dispatch. We can look at the front page of the Daily Guide. It says, Professor Hoy's book on Rollins. It's on the front page. And another story here says KGL Technology, gets NA licenses to operate. And stop pussyfooting, bring your evidence is also on the front page. And Rollins' close associates replies him again. Details of that story in the Daily Guide. It says Mahama brother fights Amidu with UK lawyers. It's a story by Ernest Kofi Edu. We also have court convicts for contempt, and a 66-page situation plan final phase to pull out is also inside, and injunction against acting Auditor General's.
Looks like we have some issues there with the connection to Joseph Akable. So whilst we fix that, let's do the Daily Graphic newspaper, which is also very heavy today, but we know that it's because of the Electoral Commission's rollout plan. If you want to check, they haven't been in your area, you might want to check what's in the graphic. But front page, President cuts sword for Tamale Yendi water projects. There's a special supplement on Idil Adha in the inside pages of today's graphic. Also make asset declaration public. Chairman Sabonsu advocates. Domalovo's office not shut, according to the board chair. Joseph Akable would give us some background because he filed the story for us. The chairman of the audit service making some comments. He would brief us. 5 more arrested over Kafaba lynching, according to the story on page 23. Some 5 persons turned themselves in. So they came forward to the police and they were arrested. And they're making an appeal. If you were there, you saw what happened, you live in the community, the police is asking that you help them with their investigations. KGL Technology gets online lottery operation license. In the center spread, of course, they've got Idil Adha sermon to go virtual. Compute Ghana trusted naming technology. Well, there's a story on them as well. Boache Jackal's Eid message, coalition against Muslims to avoid lofty lifestyles. On the back page, Magdan Foundation donates dialysis machines to 37 military hospital. Ghanaian Nigerian spare parts dealers in brawl over retail trade. We extensively covered the story from when it broke, when Maxwell Agbagba, till how it all ended yesterday. Joseph, we didn't quite get the entire review, so let's go over your papers again.
Okay, so my papers, the front page of the Daily Guide had the story about Mohammed's brother fighting Martin Amidu with UK lawyers, and also the Melevo case back on. An injunction against Auditor General struck out also on the front page of the Daily Guide. Then another story about Kafaba victim recounts ordeal, also on the front page of the Daily Guide.
Okay.
Then for the Daily Dispatch had this story about Rollins' close associates replying him again. And this story about stop pussyfooting, bring your evidence is also on the front page. Yeah. So those are the stories for Daily Dispatch and Daily Guide.
Okay, all right. So there you have it on the on your screen. Stop pussyfooting. Front page of the Ghanaian Times newspaper. This is the Times. President's directive to Auditor General to proceed on leave. Supreme Court strikes out Domalovo case. NLA partners KGL Technology to advance digital lottery. That headline also here. Keep nation focused on COVID-19 as election 2020 approaches. Some Jonah appeals to media. Magdan donates 3 dialysis machines to 37 military hospital. Parliament approves over 11.8 billion Ghana cedis per supplementary budgets. On the back page, President cuts sword for water expansion projects in Yendi, Tamale. ECG supports infectious disease center with materials engineering works valued at 320,000 Ghana cedis. Oh my God, finally. I'll give you the backstory to this tomorrow, God willing, Roland.
Hi, ambassadors. Joseph, what's your pick? Joseph is here.
I thought you had some papers.
No,
okay, so Joseph, we wanted you to tell us about the Auditor General, the updates with the chairman of the audit service speaking and making some comments. And then we can also go to the courts because you were in court yesterday.
Yes, he makes the point that as far as he is concerned, he doesn't think there's any issue about Mr. Demolevo's office being locked out, and he explains that this is because he had been informed by the acting Auditor General that they needed to secure the office because Mr. Demolevo had come there some days earlier to pick documents from the office, and so that is what necessitated them changing the locks, and that they tried to give the keys to the Secretary of the Auditor General, but he wasn't. He declined taking the key, for which reason they handed it over to the Treasurer. And so, if Mr. Demelovo had actually gone to the Treasurer, he would have gotten access to the key. So he thinks that Mr. Demelovo simply wants to cut the sympathy of the media and create the impression that someone is working against him or wants him out of office. That's why instead of going for the key, put that information out there that he has been locked out. But the question I asked him was that, I mean, how is that? Did they inform him when they were changing the locks? He said, no, they didn't, because he wasn't around. Then I said, I mean, how do you change someone's office when he is not available? Then he still insists that they had to secure the office.
Professor Dia
Ajimai,
yes. Former Auditor General.
Exactly.
Chair.
Exactly.
Right.
Yeah, we're here. But just quickly before Gifty comes in, also the courts.
So, I mean,
okay, Gifty, go ahead.
Go ahead, Gifty.
Okay, so I just wanted to say that, I mean, this is the most perhaps ridiculous story that I have heard. I mean, I know that governments change and a lot of ridiculous things happen, but honestly, it's not rocket science to see through what is happening. And we're not children in this country. I mean, we're smarter than that. I mean, people should, show us some respect. Don't look down on our intelligence. You know what I mean? Don't insult our intelligence this way. I think that it's obvious, and we need to say it as it is, as uncomfortable as it may sound sometimes. Who goes on leave and can't have access to their office? Really? I mean, and Joseph, when he says that Mr. Demelovo is trying to court the sympathy of the media, you don't need to court the sympathy of the media. When people see the work you're doing and they believe it is in their interest, they will speak for you. They will go for you. It's not about us. It's about the people who like the work that Mr. Demelovo did, and they believe that he's been called out, singled out because of the work that he did, taking on officials. So, I mean, it sounds really ridiculous that once you go on leave, you're out of the office, someone changes your locks, and they say you have to tell us before you come to the office. It doesn't make sense. And I was hoping that yesterday we could have asked Professor Ajimai about his experience. Yeah, he was asked to go on leave.
He told me that when he was at the audit service as Auditor General, he never kept his keys, and so he doesn't understand why.
When he went on leave, was the door lock changed? I don't know. I was hoping that he would answer that too.
No, but he says the keys were always in the custody of the Secretary. So when you come in, then you pick the key, and so you don't have to. So if the keys had actually been changed, when you come in, you will still get the key from the Secretary, and you don't have the key on you when you are coming in.
So Joseph, one more thing. Who were they? So they were securing the office for who exactly?
So the acting Auditor General apparently says he doesn't feel safe. I mean, he's not sure about the security and the office.
What?
So then he was.
Is he using the substantive office? I mean,
no, he's not using the office. I asked him that question. He said he's using his own office.
So why is he securing the Auditor General's office?
So according to the board chairman, he says that because he is acting, he expects that in the event the Auditor General comes to the office to do whatever he comes in to do, he needs to at least give him heads up that, okay, I've come around on this day. So that if anything happens, they'll be able to trace it. And that's
you mean the main... No, you mean the main man, the man himself. The man himself, who is the boss, but has just gone on leave, should come and report to
the acting. His deputy.
Yeah,
right.
Give him heads up.
According to the...
is on leave. It's like Elvis is on leave and Elvis wants to come to the office, and you're saying that Elvis should call Emily, or she should call
it means that Elvis' position is under lock and key.
Can you open up my office? You know, we're intelligent people. We're intelligent Ghanaian people who have been taken through school. Someone says we have done our degrees. We can read through the lines.
Yeah,
I mean,
we have
don't insult our intelligence.
Yeah,
this is our plight when we bring politics into everything in this country.
Yeah, but let's go on to other issues before the time is
just
up,
in 2 minutes.
Just a real quick, the court issue on this.
And so first, the injunction related to the leave was dismissed. They had wanted the acting auditor general to also be restrained from acting as such. That was also dismissed by the court. Then the court also removed the auditor general Daniel Domelevo and Johnson Ekwame as defendants in the case filed by Professor Stephen Asari. And so that deals with this initial aspect of the case, but the substantive case is still before the court, Marvin.
Okay. All right. Gifty, there was a story you were interested in?
Yes, the water project in the northern region, Tamale Yendi, Dagbon to be specific.
We should make you an ambassador, because this week you've been very passionate about this water project.
I am. I don't, and it's not just a water project, but I don't know, but there's something that just attracts me to the northern part of the country. I don't know. It's not like I really dated anybody from that area too, so I'm not really sure. But I'm really particularly interested in that area. I think it's the love I speak.
No, I think it's the way, you know, when you watch the Ghana map, the way the lines are. You love the shape.
I think it's the love I feel. It's a love I feel. That is a love that, you know, radiates when I get to the northern region to do any story.
Your love making time is up with Northern Ghana. It's up. We have to.
I covered the wrap up of the Yendi peace process, and these were some of the things that the people were expecting. They were expecting to see development in the area. And I think that when we do that, the likelihood that we can bring down the tendency of any escalation of tension, conflict, etc., is really high. So I think that's an area of focus we should really put our attention to. So this is one of the things that President Akufo-Addo promised when he went there for the coronation. And I think it's just great that he's doing it. He should do the others as well. Scholarship schemes for the people.
Well said,
bringing
Gifty.
jobs to them as well. That's great.
On that note, Gifty, unfortunately, our time is up. We ask our viewers to log on to myjoyline.com, where we've got a lot of stories. Joseph, thank you for joining us. Gifty is back on Pulse at 3 p.m. today. Jaibibia Nesha Pulse. That's her slogan. Stay with us. Today, we're focusing on children. There are certain things that we're learning about young children. We leave them at home. They're spending lots of time, sometimes by themselves, and they're coming, reporting to the hospital with some accident. You have to realign certain things in your home. We're also told that certain critical conditions that needs regular checkups are not being reported because of COVID. So children are ending up in the emergency instead of the regular OPDs because parents are just not taking them. We're discussing this issue. We've got two pediatricians, one in the Greater Accra region, the other in the Ashanti region, joining us. We would love to hear from you. But first, sports.
Hello. Yes, how are you?
I'm fine, Mom.
A tired mother looks straight at the electronic device before her. She laughs. The tablet is the safest way to touch base with family, but keep her distance as she works to save lives. Evelyn Nakidowuna is Quality and Safety Manager, Infection, Prevention and Control at the Ga East Municipal Hospital. Her job involves ensuring that the facility meets world standards in treating COVID-19 patients. Over 400 patients have been here in the past 5 months with an encouraging rate of recovery. Evelyn is a mother of a 9-year-old who has always been close to his mother.
I've missed you.
Yes, I miss you too.
Evelyn has been living in a facility provided by the hospital for the past 5 months, sacrificing family time on her patients.
I moved in for the ending of beginning of March, and so I have to put in a whole lot. I haven't been able to go. I was able to go home once. We do a lot of WhatsApp call, video call to see them and talk. But if I had to go do something, my mom wants to see me. So he has a way of saying it. I bought something for you because you're not able to go to the market. Come for this nice dress, come for this shoe. Just ask permission and go and see them. They was like, oh, won't you sleep for today? No, my job doesn't mean I should sleep.
And with rising cases of coronavirus, she barely has time for anything else.
At times I even forget to eat. So one of them who has taken the responsibility, Madam, you haven't eaten. Then just give me a reminder.
She thanks God for the staff of the Ga East Hospital who look out for each other within the period.
They are my deputies, I will say that. So they've actually been able to man the front. And so I just, instead of reporting at 6 a.m., I now come at 8:30. They've really helped me a lot, and I cannot do without them. And I say big thank you to them.
But her biggest motivation is little Emmanuel Annan. her son living with her own mother, whom she checks up on from time to time. The love keeps her strong. The little boy's understanding of his mother's duties keeps her sane at such a period when she sacrifices to aid Ghana combat COVID-19.
I hope the president will want whatever you're doing and appreciate you.
Oh, okay. They will hear, okay? But you have to stay safe for me, okay? And put on, well, use your sanitizer often, okay? I will stay safe. You to stay safe, okay?
PSC Nanaya Safo, Joy News.
Bye.
Bye.
Welcome to our Healthy Thursday conversation, where we put the spotlight on a health issue affecting us, but particularly around this period of COVID-19, we tend to have conversations related to it. Today, we put the spotlight on our children. Many of us have children back at home. We have to go to work. Sometimes we have people taking care of them, but it's not the same when the parent is not around. So we're told that there are incidents being recorded in the hospitals because children are getting injuries in the home, mostly because of lack of thorough supervision. We also have been told of incidents where parents are not confident enough to take their children to the hospital to be taken care of. So cases are being reported rather late. Today, we're talking to the pediatricians. We have one joining us from Kumasi and one in Accra. My guests, Dr. Ajwa Amamo, is a member of the Pediatric Society of Ghana, but she is also a pediatrician at Shimota Hospital. Good morning to you, Doc. Can you say hello to me and my viewers?
Good morning to you and to all the cherished viewers of Joy News.
Okay, great. Thanks for having you. We also have Dr. Gloria Mponsa-Kodia, who's also a pediatrician at the Tafo Government Hospital in Kumasi and also a member of the Pediatric Society of Ghana. Thank you, Doc, for also joining the conversation.
Hi, Mama V. Good morning to you and good morning to your cherished viewers. Hi, Ajwa.
Hi, Gloria.
Okay, so it's good to have both of you, and it's good to have the perspective from Kumasi and Accra. So can I start with Dr. Amamo on the trends that you've observed?
All right. In the current times which we have, which is the COVID times, they are not normal times, and we have seen a drop. Initially, when the lockdown started, a very drastic drop in children reporting to the OPD. This is because, as you said earlier, parents did not feel safe, and due to the lockdown and the stay at home, which we were encouraging, most people were not bringing their children early enough to hospital. As a result, you are right. We're seeing children who usually come in and need admission most of the time because they've been ill for longer and the illness is a bit more severe because the parents didn't report early enough and then kept trying home remedies instead.
Okay. Can we also have the Kumasi perspective? Dr. Mponsa-Kodia.
Yes, Mama B, it's quite similar. Yes. So the situation is also similar in Kumasi. When the lockdown started, we had a very drastic reduction. But now it started picking up anyway. But then generally, the OPD attendance has reduced and parents are still worried about coming to the hospital and getting the virus. And so what I've noticed is that they usually go to the pharmacy shops to buy medication for their wards when they are not feeling well. They would rather go there, get the medicine, than come to the hospital. And so we tend to see patients coming late into the illness, the onset of the illness, and they often come with complications too. Sometimes the wrong medication is given, and in addition to the complication of the illness, you also have to deal with the side effects of this wrong medication that was administered. Some also try herbal preparation, which has been with us for a long time. But currently, you see an increase in the number of patients who have come because they've gone to the pharmacy shops and gotten some medication for an illness which they shouldn't have taken that medication for. So yes, attendance has reduced. We are seeing cases late. And in addition to that, we also have to deal with the complications from wrong medications that they've taken.
So Dr. Amamo, what diseases are being reported? Is there something that is particularly common around this time?
Well, children usually present with upper respiratory tract infections, which is the bulk of what we see at the OPD. That has not changed. However, as I said before, the children that come in now are usually a bit more sick and may need admission. The neonates also, that is the newborns, also present with a lot of jaundice. And we are seeing maybe a slightly higher trend in reportage of home accidents and food poisoning.
Food poisoning?
Well, a slightly higher rate that we would have had in normal times.
Okay. Now that you've introduced the home accident, let's talk about accidents such as?
So there's a very wide range of accidents that are reported. Most that report to our OPD are related to falls, motor vehicle accidents, and then children who are pedestrians and involved in accidents. We have other injuries that also come in as and when.
Okay. But Dr. Amponsa-Kodia, what's wrong with going to the pharmacy and getting something if I feel my child is either hot or coming down with something before I report to the hospital if it gets severe?
Okay, so the problem with that is that, at the hospitals, when a person comes, we examine the person after taking the history. That's listening to the mother talk about what's wrong with the child, what is noticed in the child. We also do an examination. So we look at the child, we examine the child, check the breathing, check the heart rate, feel for any things in the abdomen, which it's not supposed to be there. And then we also do lab investigations. So when you go to the pharmacy shop, you might not get all these things being done for you. And they listen to you and then prescribe medication based on what you say. But when you examine the person, you may find something different. And then when you do the labs too, the diagnosis may actually change. You may have to add a few things or take out a few things. So you don't get that comprehensive assessment in the pharmacy shops as you would in the hospitals. And that's why you may not get the right medication if you go to the pharmacy shops. Usually the pharmacy shops are supposed to be a first aid center. So you have a fever, you quickly go get paracetamol. You have some pain, you quickly go get a pain relief. But if the child is really sick, after that, he has to be brought to the hospital for a very comprehensive assessment and then the right medication prescribed.
Just to continue with you, the home accident that we heard from Dr. Amamo with her observations at the Achimota Hospital, is it the same with you?
Yes. As I speak to you, we even have one on the ward that we are managing. And even last week, we also had a child who had gone to ingest chew a bar of soap, and the parents had tried to induce vomiting, get the child to vomit it out, and she came in with complications. So yes, we are getting patients, children coming in with home accidents. And we also have, it's the rainy season, so we are also getting cases of malaria, a surge in the cases of malaria we are having and also the common colds and other pneumonia and other respiratory diseases. But we are getting home accidents as well.
Okay. Dr. Mamo, you understand the fears that parents have around this time. You don't want to quickly rush your child to the hospital. We know that the cases are increasing. We're living in the new normal. We're recording a lot more COVID-19 cases. And sometimes you are not very sure if the mask the child is wearing is safe enough, if it's protective enough. And we're told also children under a certain age should not even wear masks at all. So if you're taking your child outside the home, you're worried. And so you're not rushing to take them to the OPD.
I think what you are saying is true, but largely I would like to allay parents' fears. This is because hospitals are aware that our environment attracts a lot of sick people who may include COVID patients. Because of this, the Ghana Health Service has put in a lot of policies. The hospitals, my hospital in particular, has put in a lot of policies to help protect children and other patients who come to the hospital. The first is having a common entry, and now almost every hospital is screening everyone with a temperature and a questionnaire before the patient is even allowed in. And based on your symptoms, you may be asked to join a separate queue if we think you may have the disease, so that you don't even mix with the OPD. At the OPD as well, there's been a lot of spacing done so that some chairs are crossed out, and we're trying to socially distance patients. We're also trying to rotate such that at any point in time, the numbers that are there, the turnover, we try to work fast so that people can be seen faster, and then there are no crowds as much as possible. So a lot is being done. And then in the hospital, the policy is no mask, no entry, which is even safer for us because most other places, you don't even see people wearing the mask anymore, which is worrying. But in the hospital, everyone, child, especially above 2 years, has to wear a mask. And in the consulting room, it's also done. So there are a lot of measures that are being put in place. And we want to reassure parents that you will not be putting your life or your child's life at excessive risk if you decide to bring the child to hospital.
Dr. Mponsa-Kodia, I also heard yesterday that some parents who are also, especially the children with either asthma or sickle cells, those who need the regular periodic checks, are also not showing up. What are you recording? Dr. Mponsa-Kodia, if you heard the question.
Yes, can you hear me now?
Yes, I can hear you. I hope you heard me.
Yes, okay. I did. So it's true. We are getting a reduction in the number of these cases too. So what we call the chronic cases that need regular follow-up, the sickle cell, asthma, epilepsy, and then other developmental disorders. So yes, generally there's a reduction in the trend, and those with chronic cases who need regular checkups and need their routine medication, the attendance of these people in the hospitals have also gone down. And I think it's likely due to the fear of contracting the coronavirus disease, the COVID-19. So yes, attendance has gone down.
I'll let you two help us with some tips. If you have a child with asthma, if you have a child with sickle cells, and then how do we even prevent those accidents that you talked about, knowing that children are home, sometimes by themselves. But I want to invite our viewers, if you're watching, you have questions that you want to ask us. Our concentration purely is on our children. So if you've got questions, kindly give me a call on 030221169102, 030221169102. Call me now. Let our doctors help you out with your questions and then the comments that you may have. So straight away, Dr. Mamo, let's talk about how do we prevent some of the accidents that we're recording these days?
So there's been a lot of research into this in more developed countries, and over here with the motor vehicle accidents, for that, it's been shown that children, especially children even up to 8 years, have to have a seat belt or some form of a car seat. So if you have an infant less than 1 year, the child needs to be in a car seat and needs to be at the back. No child should be allowed to sit in the front if they are under 13 years old, because it's been shown that the airbags do not protect children because they are designed for adults. Apart from the use of the car seats, any child under 5 is prone to driveway accidents. So a parent is going out of the driveway and then the child kind of crosses at the back and nobody sees the child and the child gets run over. If you have such a child, then the child should be kept indoors whenever the car is around or about to move. The children should be kept indoors. Also, children who are under 10 years may not always be able to negotiate through heavy traffic on their own. So if you are a parent of such a child, you should let the child know that you don't cross the road on your own. You need to get someone to assist you. And you should take that primary responsibility up as much as possible as a parent to ensure that the child gets to where they're going safely and comes back safe. It's also very important to get a safe play area for kids, because now kids are at home 24/7 and they find all kinds of places to play which can lead them make them prone to accidents. For instance, children should not be allowed in the kitchen, and the kitchen should not be the play area for children.
Okay. All right, great. I have some follow-up questions that I would ask you, but just hang in there for me. Isaac is joining us from Labadi. Isaac, good morning. Thanks for calling.
Yeah, thank you very much and good morning.
Great. Good morning. Let's hear you.
Yes, I want to find out whether, especially with children, do we have a special guidelines for children in wearing face masks? And when children are immunized, are they protected from COVID or chickenpox?
Okay. All right, Isaac, thanks for your call. Doctors, who will take Isaac's question?
Okay, let me help.
Okay.
Isaac, thank you for your question. So usually children who cannot talk well and tell if there's a problem or if they can't breathe well should not be in masks. So for instance, children who are usually less than 4, they may not be able to speak well, and if they are suffocating whilst wearing the mask, if they are not getting enough air, they may not be able to articulate it properly. And so we don't recommend children less than 4 to be in masks. And even those who are older than 4, but for some reason, maybe developmental delay and other neuro disabilities, problems affecting the brain development, like cerebral palsy and other things. So they are older children, but may not still be able to speak well. And so such children, we don't recommend the wearing of masks for. And then when it comes to vaccination, the vaccination centers are also safe because they are instituting the same protocols. The nurses are wearing masks. The parents are also told to wear masks. It's the children being vaccinated who usually are not in masks because they are too young to wear masks. But we also ensure that there is social or physical distancing there so that the children are also protected. And we do have vaccines for various diseases, but chickenpox is not one of the vaccines that are in the expanded program of immunization that we have in Ghana. So chickenpox is not one of them, but we have other diseases that children are vaccinated against. and the vaccination centers are also safe.
Okay. Atika is in Salaga. Let's hear from Atika. Good morning.
Good morning, madam.
Yes, ma'am. Thank you. Let's hear you.
I have a problem with my children, all of them. They are about 4. No. When they are sleeping in the night, the person will just wake up and be complaining of the legs are paining, and the person will be crying the whole night. And I want to find out whether you will help me to detect the cause of.
Okay, can we have you do the narration again? You said you have a 4-year-old, correct?
No, the children, they are about 4 with me.
You have about 4 children?
Children, and all of them are complaining the same sickness. Okay,
which is, what are the signs again, the symptoms?
They'll be holding their legs, wailing that is, the bones are paining them.
Okay.
In different times.
Okay. Is there a time when they complain? Is it at night?
At night.
Okay. All right. Well, thanks for the question. Dr. Mamo, can you help us?
Yes, I just wanted to add to the previous one. The chickenpox vaccine is actually available as a private vaccine. So for those who can afford, because you need to pay for it, your child can be protected. Aside that, for this mother who has 4 children complaining of this, I would advise her to come to the hospital. Sometimes some of these pain issues may even be due to chronic conditions like sickle cell, but the child needs an evaluation, especially if it has persisted. So as Dr. Kodria said, the child needs to go to the doctor, be inspected, have an examination done, and then if labs are needed, and then if she needs to be reassured, it would be a very simple procedure.
Okay, all right, great. There's a question that I wanted to ask on the wearing of mask when you were talking about it, but I'm sure it will just come up again. But I remember now. Is it, which of the mask would you recommend? Is it the fabric, the local fabric one that are sewn, or the surgical one? Which one should we give to children?
All right. Okay, so against that.
So both are actually okay. They are you can breathe through them easily, and so it all comes to availability. With the cloth mask, you get to wash and reuse them. So if that's convenient for you, you can go ahead and have that one. And for the surgical mask, you know that if it's soiled, you have to throw it away. But both are actually safe for the children.
Dr. Mamo?
Yeah, the cloth mask is also good because sometimes they fit better for the kids. But for the surgical mask, what I've noticed is that most people, Dr. Kodria said it, they tend to reuse. I put it down today and tomorrow I want to put the same thing on the child. That's not how it's done. And then the fit for the surgical mask, especially in younger children, may not be so good. So you may need to adjust it to make sure that it covers the face very well when you put it on the child.
Okay, let's go to the phone lines. Obed is in Dorwenya. Good morning, Obed.
Good morning.
Yes, thank you for calling. Let's hear you.
I want to make a follow-up on the chickenpox vaccine. Yeah, I want to know at what age should a person be vaccinated? And as you said, what are some of the possible shops or facilities we can go and assess those facilities?
Okay, all right. Thanks, Obed. Dr. Mamo?
Okay, so usually the chickenpox vaccine, I think after 2, you can give it. After 2, it can be given after 2 years of age. There are a lot of private places, but I'm not on air to advertise any one of them. So talk to your doctor and you'll be directed to the right places to go. But there are places around, especially in Accra, where you can get it.
Moses is in Keta. He joins us on the phone. Moses, good morning.
Hello, good morning. Mama
Alfo, you're on air. Let's hear you. Miracle, you're more for.
Okay, what's your mother?
Okay, Moses, we're listening.
Yeah, God himself knows how to secure the vulnerable ones. So the children are having a certain kind of very strong immune system that will help them naturally to overcome any sort of infection. That is why they don't need any kind of face masks. So, however, that doesn't mean that they should go back to school. They should stay at home. God has prepared a very natural immune system for them. Thank you.
Okay, well, thank you, Moses. I think you're passionate about a certain cause, and then you decided to call and share. We appreciate it. Thanks a lot. That's Moses calling from Keta. But on the back of what Moses just asked, let's talk about the immune system of children and what we can do to boost it. I've heard comments like children can better fight COVID-19. I don't know how true that is because they have a stronger immune system. Can you please spend a bit of time helping us understand this? Doctors? Dr. Mponsah-Kodie, I'll start with you.
All right, sure. So, yes, it's true. What we've noticed is that children to get a milder form.
Unfortunately, we seem to having some breaks in that. So let me just go to Dr. Mamo. We'll come back to you, Dr. Mponsah-Kodie. Dr. Mamo, can you help us?
Hello?
Yes, Doc, we can hear you.
Yes, studies currently show that most children have very mild disease when it comes to the COVID. However, this does not mean that the child should not be protected. Children are a vulnerable group, which is recognized in our society, and they need to be protected. However, there have also been cases, even in our hospitals, of children who have suffered severe neurologic impairment or respiratory complications from COVID, though this is on the lesser side. So the children, yes, have an immune response that usually produces a mild disease with COVID, but there are children who have reported severe illness as well.
Okay. Let's go back to the phone lines. Akpene is in the Sojaman in the Eastern region. Akpene, good morning. You're on air.
Good morning, Mama. We are fine.
Maraku, mo phone half one.
No, sir.
Okay. Let's hear you. I would appreciate it if you speak the English so that our doctors can hear from you. Go ahead. I'll do the translation.
Okay, I translate now.
You must see.
My symptoms I don't have another COVID. My general fear is I'm a pa. Nyetana meli se nye temperature is avanja. Kono meli afifia ponade nye ever. My son after for last week. Then you start your video less than 2 months. Eko me vovo me maybe na my test positive day the via the key.
Okay. Cut the via phone on you ho.
Less than 2 months.
Okay. Okay. All right, Akpene, Akwesia. Okay, doctors, let me help with the translation. Akpene from Esojaman is complaining. So she thinks she may have some symptoms of COVID. For instance, sweating and high temperature at night. Her fear, though, is if she tests positive, then it's going to affect her 2-month-old baby. Dr. Mponsah-Kodie or Dr. Mamo,
yes,
any of you?
I hope the line is
yes, it is. Now. It is. The line is clear. Please go ahead.
And I'm picking a few other words from you, free of charge. Thank you for that. So, yes, she has fever, which could be a sign of COVID, but could also be the sign of a number of other diseases. So it's better for her to get tested. And there's the phone line, the 112 that she can call and then get advice on what to do from. But if that also doesn't work, if she calls and she doesn't get any response, she can go to the hospital, but making sure that she has her mask on and then observe the physical distancing and tell those at the front desk that she has fever and she has symptoms that she suspects might be COVID. Those there would know what to do with her. But whatever be the case, it's important that she gets the assessment done and the treatment started early to avoid any complications. And as for the 2-month-old, even if that child, if the mother has COVID and so makes that child exposed or even infected, there are still things to do for that 2-month-old. It's better for her to go to the hospital, be assessed, and the treatment started early. Early treatment helps to improve the outcome. And there's so much that can be done for this 2-month-old. So she shouldn't be afraid to have the assessments done at the hospital.
Thank you, Doc. Dr. Mamo, so will she still breastfeed? I mean, should she still continue doing the things that she does, knowing that she's showing symptoms?
WHO actually recommends that children or babies born to COVID-positive mothers can be breastfed if the mother is in such a position to do so. It's only if the mother is very unwell that she cannot breastfeed that breastfeeding is stopped at that point. So breastfeeding, yes, can continue. The other thing is, as Dr. Ampunsakudria said, it's better for her to get to her physician, get assessed, and then whatever treatment may be assessed for her and for her child can be done quickly, because we have recorded cases of COVID in even units, a few though. So it's better to get reported. Early treatment actually helps. It's very, you get better outcomes when treatment is done early.
Okay, all right. Let's go to Majid. Majid is in Kentampo, and then I'll come to you, Kwabena, calling from Spintex. Majid, thank you for holding. Good morning. Yes, sir. Let's hear you.
Okay. When we talk of children, hello.
Majid, we can hear you. Go ahead.
Children are very prone to a lot of diseases, and then COVID-19 is of no exception. Well, I remember in Italy, there was an instance where a 17-day-old baby was contracted with COVID-19. I don't know if you could remember that instance. And then if we expose our children to the environment when COVID exists, I doubt if they will be able to follow all the outlined protocols.
Okay.
I think this is my take. So children should be well taken care of.
Okay.
And then once they are the vulnerable ones.
Okay. All right, Majid. Thank you very much, Majid from Kintampo, for your comment. Kwamina from Spintex, unfortunately, we lost you. Kindly give us a call back. I think we have just some time to still spend on this conversation. I have some follow-up questions. So I give my children zinc and vitamin C. Now, yesterday I was thinking, so for how long can I do that? And this is talking about boosting the child's immune system. What should you give the child to boost their system? Dr. Kodia.
Okay, so children should get the right nutrition, COVID or no COVID, because there are also other which should still be around even after COVID.
Unfortunately, the network is going bad again. The connection is going bad. But let me speak to Kwesi. I'll come back to you, Dr. Ampunsakudria, for you to conclude on that. Kwesi Afol is joining us on phone. Good morning, Kwesi, from Kumasi. Hello, Kwesi.
Good morning, madam.
Good morning, sir. You're on air. Let's hear you.
I have a question. I have a question.
Okay.
Whether you can give me a chance.
Okay, please go ahead.
Okay. If the woman has a baby, the woman has a baby and he got an what do you call it, a COVID. The child can and if he breastfeed the baby, can the baby get a infection?
Okay, that's your question.
Yes.
Okay. It's actually been answered already. The answer was no. But let's get some more education on that. So thank you for asking this question. Dr. Mamo, I think you made a comment on this. The follow-up question that I had was, should the mother be wearing mask all the time when they are breastfeeding?
Yes, they would have to be masked because the mother's symptoms will definitely have a cough, which can transmit droplets to the baby. So the mother would have to be masked when breastfeeding, but she can breastfeed.
I am just thinking about how practical this would be. You have a baby, you are the mother, and you're taking care of the child. Can you be conscious of the situation and wear mask all the time?
Not all the time, but when you are breastfeeding, if you have symptoms like cough, yes, you should be masked during the breastfeeding. With the other times, we know there's hand washing. It takes practice, even for us as it takes practice, it takes conscientiousness, but you can do it. You can do it because in that way you protect yourself and you protect your baby.
Okay. All right. So Uncle Kwesi, that's your answer there. But the woman must wear a mask. Let's talk to Saibu in Tamale, and then I'll come to you, Dr. Amponsah-Kodia. Saibu from Tamale. Good morning.
Good morning.
Yes, sir. You're on air.
Okay. My contribution is that we should allow the rural children to go to school.
Oh, you want children to go to school? Okay. I hear you. Unfortunately, because let's hear you.
Go to the rural communities in the north here in particular. The children, the whole community, the children are congregating at one place and they are playing together. And if they are in school, teachers will be there to guide them to observe the protocols and other things. But at home, parents go to farm and leave them alone. And I think that if they are in school and they are being taught and also be guided, it's better than they being in the house and playing all by themselves.
Okay.
So that's my contribution.
Oh, and we appreciate it. Thank you very much. Dr. Amponsah-Kodia, let's talk about, we'll come to the playgrounds, but let's talk about what you were commenting on, boosting the immune system of a child. You said nutrition.
Yes. So let me quickly add that with the breastfeeding mother, she should also try to be in a mask anytime she's within like 2 meters, within 2 meters, when he's close to the child, he has to be in a mask. So even though it's uncomfortable wearing the mask, Mama B, you know that we are not in normal times, and so we must try to do as much as possible to protect ourselves and our babies.
Yeah.
So yes, whilst breastfeeding, anytime he's close to the child, he must also be in a mask. And as Dr. Mamo said, the hand washing.
Okay. Let me take the phone. Doc, let me take the phone calls and I'll come to you. I've got Kojo Ahen. Kojo Ahen is in Takoradi. Kojo, good morning.
Good morning.
Yes, sir. You're on air.
Please, I want to ask a question that I heard one of the doctors say it's a must for a parent to wear nose masks when breastfeeding her children. So I want to ask, what if the person has a sweat on the body and the child touches the body? Will the child be infected with the coronavirus?
That's a very good question. Well, thank you, Kojo. Let's go to Kwamina. Kwamina from Spintex. Thanks for calling back after we lost you earlier.
Hello.
Yes, hi, Kwamina. Go ahead, you're on air.
Yeah, I just want to add my voice to the program. You've seen that since the COVID-19 came, all the rules, the rules that was rolled out for us, keeping distance and etc., was meant for adults, and children were left out. For instance, if you are breastfeeding your baby, you were told not to shake hands. But if you are putting your breast into the mouth of your baby, the education was not given as to how to handle it, because it is also, we believe that when you put a breast into the mouth of your baby, it's possible if there's the virus is on around the breast, you can pass it on to the baby. You see, but those education were not given. So I want to advise that they should intensify the education for children, safety, so that they also they are also part of the society.
Okay, we really appreciate your contribution. Thank you. Let me go to Rim. Rim is in Kenya, say in the Ahafu region. Perhaps our last call. Rim, good morning.
Good morning.
Yes, sir. Let's hear you.
Please, someone called in initially asking of how to boost the children's immune system in terms of times like this. But please, you early on made a statement that you give your children vitamin C, then zinc tablet. How advisable is that? Should you continue giving them those drugs, knowing that, because one thing I've realized is every drug comes with a side effect. How long can they continue taking those drugs, or is it even advisable for them to continuously taking those drugs?
Okay, yeah.
I wanted to be clear on.
Well, I also have a personal question like that, so thanks for asking. I'll get the doctors to respond. I think our very last call is Genia is in Techiman. Genia, good morning.
Okay.
Hello, Genia, you're on air.
Yeah. Please, my question is, I heard people saying that they should allow the children to go back to school. And my question is, the children coming from different homes to mingle with other children in the school, in case they contract the virus, what is the probability that they will not send it back to their parents after school to infect other people in the community? Because they are coming from different homes, different communities together. Okay.
All right, Junior, thank you very much for your comments. That was an observation that was made, and I thought it was peculiar to the environment. But thank you very much for adding your voice. Doctors, let's talk about the concerns raised by Kojo Ahen from Takra. They will come to Kwabene's question and then Rim, which was the same as the question that I asked. So a mother breastfeeding, there are issues with that. Let's address the concerns that have come up. Dr. Cody, I think you were attempting, I was starting the boosting, the immune booster question with you, but let's hold on to that and let's address the issues that have come up.
Breastfeeding, okay. So with that breastfeeding, a lot of studies have been done, and they have noticed that, they've noticed that the virus is not in breast milk. And so I think we just have to educate people more to allay their fears. But as far as the studies that have been done are concerned, the virus is not in the breast milk of the mother, an affected mother. And so an affected mother can still go ahead and breastfeed the child, and the child will not get the COVID-19. It's as you sneeze, and then it gets into contact with a child's mouth or nose or eyes. That is
Unfortunately, technology is not helping with a good flow, but I can come to you, Dr. Amamu, so you can continue.
Okay, so I think Dr. Kudia has said everything. With the breastfeeding, the way it could also transmit if the hands are not
roots of infection. And so as when you're breastfeeding,
Dr. Mponsa Kodia, can you hear me, please? Hello, Dr. Mponsa Kodia. Okay, so the issue is we don't have a great connection right now. It's freezing on us. Dr. Mponsa Kodia, please, can you hear me? Dr. Mamo, can you hear me, please?
Yes.
Okay, Dr. Mamo, let's go with you. The network was still bad when you started, so please begin again for us.
Okay, so Dr. Sakodria said it all. It's not found in breast milk. The thing is, if your hands are contaminated, you could transmit it onto the breast. So you just wash your hands with soap and water before breastfeeding. And that's something you consciously have to do to reduce the risk.
But you know, Kamna from Spintex also raised the issue of the body fluids.
So sweat, and I don't have that data currently. It's not one of the listed ones that I'm aware of, but I think if Dr. Amponsakudia would add something to it.
Okay, sure. Dr. Amponsakudia, hopefully we are not freezing. Aha, we can hear you now.
Okay, good. So it has not been found in sweat yet. So there should not be any fear that the child will touch the mother's sweat and then will get infected. Having said that, it's still a new virus. It keeps changing. We should observe all the protocols, but don't say that because I'm sweating, I will not breastfeed my child. Okay. Currently, there are no studies suggesting that the virus has been found in sweat.
So how do you generally treat the breasts? How do you handle the breasts?
So you wash your hands before you breastfeed the child. And we usually recommend the child sucking from the breast. If for some reason the child cannot suck from the breast and you have to express into a cup, a clean cup, you can do so and then use a spoon to take the breast milk and then feed the child with it. So this is in situations where the mothers are so sick and maybe they cannot breastfeed the child, directly, but you can express the breast milk and then have somebody also breastfeed the child. But the protocols must be observed, the hands must be washed, the person who is breastfeeding or feeding the child with the express breast milk must also be in mask to prevent exposure to the mother's virus.
Okay.
But the child can suck from the breast directly or be spoon-fed from an express breast milk.
Okay. All right. We have to wrap up. So let's end with the question from Rim and the one that I also raised about boosting the immune system. I think, Dr. Kodia, you talked about the nutrition, but can we talk about the medicines that we're giving them? Because I give vitamin C and zinc, but I was just wondering, is that safe? For how long can I continue to do that?
So vitamin C, zinc, they are immune boosters. They are vitamins and minerals that are required, the body needs. We get them in food. You can also supplement them, the dietary quantities with the drugs. So you can give zinc, you can give vitamin C. Even after COVID, it can still be given. There are children who are put on zinc with some other minerals and vitamins for, as long as they live. Sickle cell patients, those with other chronic diseases, just to boost their immunity. So children can be put on zinc. You can give 10 milligrams or 20 milligrams a day. That's okay. The vitamin C too, 50 milligrams or 100 milligrams a day. That can be given. Or you can even take an orange a day. That's also fine. So zinc, hello, can you hear me?
Yes, we can hear you.
Zinc, vitamin C are safe. You can give to the children.
Okay. All right.
Hello.
Yes, we had that. We had that, Doc. Thank you. But Dr. Mamo, just on the back of that, are there side effects like Rim was raising? Are there known side effects?
There are known side effects to vitamin C overdose, but then you really have to go over the top to get that. And that means that for the child involved, you need to consult with your doctor and get an appropriate dose for the child so that you don't go into overdose and side effects, because the various drugs, the zinc formulation, for instance, it has different dosages, and some for adults, some for kids. So talk to your doctor, get a dose that is good for the child, and then we can move from there. But the best is the nutrition.
Okay.
The fruits, the vegetables, they contain a lot as well that can help a child.
Okay. I asked that because there are some of the children, and I've got 2 boys. One of them will simply not eat. I mean, it's not regular. So once you want to boost the immune system, you want to have the vitamin C and the zinc on the side. Yeah, exactly.
Just be mindful of the doses.
Okay, sure. Thank you for the advice. But doctors, thank you so much for helping us with this conversation today. Thank you for your patience and for taking all the questions and answering them as well. We're very grateful.
All right. Thank you too.
All right. So our doctors on call this morning, Dr. Gloria Amponsakuri, a pediatrician, Tafo Government Hospital in Kumasi. And from Accra, Dr. Ajwa Amamo, who is also a pediatrician at the Achimota Hospital. They are both members of the Pediatric Society of Ghana. And we thank the society for making them available to help us with this conversation. That's our Healthy Thursday conversation. Please stick to the advice that the doctors have given. Up next, we're roving. Maxwell Agbagba is in Jamestown. But before that, it has been ongoing since last week, and it is the tragic but bizarre lynching of the 90-year-old in northern Ghana. It is a sad reality that has hit us as a people. Investigations are underway, and we've gotten news from our correspondents of some more arrests made by the police command in the region. We will look at that next, but let's take you roving in Accra. Maxwell Agbagba is looking at COVID-19 and observation of protocols in the Jamestown area following a demolition that took place to make way for a mini harbor in the community. So over to you, Maxwell.
Mamavi, as you rightly stated, we are here in this community. The community is just located some meters away from the Jamestown Lighthouse. It's a fishing community that is down there. But all the people there have been relocated. In fact, let me say they have relocated to this side of town, which is very close to the Kole Lagoon, directly opposite the Ghana National Fire Service on the coastline there. They've all relocated, here. And 2 things we're looking out for. We want to find out from them what it is like living here after they relocated to this place to make way for the construction of the harbor, which we are told is being funded by the Chinese government, $60 million. We are told. We also want to find out, the adherence to COVID-19, health protocol here in the slum. And I'm grateful we have a man who is going to take us around, show us all the places that we need to visit here. Sir, you're welcome to join us.
Oh, everything is nice. BBI fine.
Okay.
Nti pede ya de wona nto na ahwe mesi wa ba no ya nice. Nti pede ya che won mesi ano oti nyama record na adi ni nya ya pede ya kan na amanfo ni nya wa ti. Nti ebra ya wo mi wa no sisi abo no wa ye no fine. Na abo no wo ye no direction na ya pede okọ no. Direction na ya pede abo no won ye no enya dem na wo ye no. Nti sisi ya nya ya de ye mushishi ye di aba ya di be no so sisi eponu ya wo season na eponu otumi ogun ne ho ya wo season so odru a onu so eponu otumi ma ne do.
Okay, I said we speed.
Nah, okay, so that
but to boss I first of all want to find out the person who say I have sitting on, to say, I could say, first thing, said, now, what, the other side. And I see a more with the Abahano. Into a house at man at saying,
oh, I sit in so, Sissy Banayaba, ya bear no so, ya point ya Jan Doano. Abonana, Mercy Wayano, Onuna, or ya take a crime. Chaddy, a babe my woman, or no, upon no doubt fine. Nti bia ante asemboni bia woni na adwem na bedu emre bi onu de se ponu mane wudo a mo wa ye no obese ye nyama bebre wa obese ye nyama bebre nti yesra aban no de mese wa ye no won bomode na de ye kire no one yen in them no for my Wayamaya. Yabetuma Tan, Nasunju Baba, Obia and Tumin can be Biana or Baby Bia will fine. Now, I say it.
Okay, let me just translate what he's saying. If you come here to this news place that they've been relocated, there's a raised platform, you know, in the ocean. Simply put, a raised platform in the ocean to allow the fishermen to, you know, to get their boats, you know, safely, you know, docked there. So what he's saying is that that platform is not, has to be raised to enable them so that when the tides are high, they can still, you know, ensure the safety of their boats here. So that's the concern that he is raising. But he's going to take me around and show me more places here. There are some gentlemen who are sitting here having fun this morning. I don't know exactly what they're doing. Let's greet them and find out from them what life is like living here, COVID-19, you know, in the slums. Let's talk to them and find out what life is like here. Hello, good morning.
Fine.
Okay, great. Let me start with. Okay, yeah.
Wanganye lebine.
Sure.
Aganye ba womba nyomane. Aganye nye juen wa ake ngame formo biji wo. Nye ba wo mase. Aganye interview wo. Aganye ke won gbasana aganye bi wo be ni ye ale. Lele tumo mini tashi ne nke nye me gbeke bi. Kenya nyome. Nka me gansho na mpapa lele ke a. Inyemi yeleleke a inyemi komi acho mi ni aikan nje akunmaje ni aikan innocent nje akunmaje e bala ke wo cheme wo abom nlelebo abane oh jollof oh aka fe record aba senyin no ka senyin no ni bo wo yu ojuem no e bala ke wo nyeke nye ba fe abo awo wonu nyenshi ode abiji wo mekomeje ngreshi mekomeje gbese mekomeje buko mekomeje asene mekomeje kole kono
Obagba habosani ono obagba habosani shibia na anama binye okay coronavirus ani ebane you know tenya na coronavirus ina ke mokowo mask ye bia
numu abere bale wo le nche to wo mo no ni ji coronavirus ne bala ke beke bia ko me ama mele because to amomo no ameju mo be ene ma no je na ban wa me.
Okay, well I'm asking him earlier he was talking about some reservations that he has about the construction of the harbor. And now we've shifted the conversation to coronavirus, and I'm asking him what it is like here, coronavirus. And he's telling me that because of the hardships and difficulties that a lot of them are going through, really, they do not think about coronavirus. He says his friends here, some of them do not even know about the existence, you know, of the virus. No ninya wo mask
no mo to wo no ne to bo na ban le nche aban ni ba wa bo bia ne ni le ju ekwe bo ni bo le nche ya to bo no ba lo wu ya alo ozumo ya no ba ne ya to bo mini ane ba bala ke bo ba ju ni bi sani bo ju bo be ni ba fe ni ko teshi because bo le nche no ko ya no abo no ye ma ni aban ba ju ni ba ne ko le bo na ke uni ke ni ga ba ko no bo ko teshi ba ju o ke nu mo pe alo ke so le mu ke fa pa mo ba ya ke nu o teshi ni ji la ne be ya o se no ya no ba pe because nu mo ji mo ni ko.
Okay, well essentially what he's saying is that they have more things to think about, bread and butter issues, and he's saying that God is the one who looks after, you know, all of us. He says that they're going through a lot, so really they don't have to think much about the virus. They have to think about their daily survival. That is what concerns them, you know, the most. Let me, I didn't call you Basani, my beer, my one kept time and all the time. I ain't capable of you. Many I don't.
Jeremy, no be an one ke eto.
Okay, well, he says they are suffering in this. He said they are suffering. They're going through a lot of difficulties. So they do not know about the existence of any virus. They do not think that there is any virus. You know, no war mask. Well, he says he does not think there's existence of any virus, so he walks around, you know, freely without thinking about, you know, any pandemic. She on work because of the virus. Virus and Okay.
Siwale ni wana ko ko imele mi ye.
Ona ko virus e ko imbe.
Ni na ko me na atompo age na me bu asako po age na me alo ne kan ni ne kan ya no alo ne kan o mi ni na ko ele mi.
Okwa joy news. Joy news wa fe ni BP ni won sabe na fun gba me ke bi ni bi ko.
No len kwako.
Okay. Well, he's saying that they've not seen people who died of the virus, and that is part of the reasons why he doubts the existence of the virus. But I was just telling him that he's not been watching Johnny's probably because we have showed a lot of things on TV to prove that there is the virus is real. Honey, ma be onyamia one touch over time.
Mumi achomi samotaki.
Samotaki. Okay, coronavirus eneba onuwe.
Inuwe mo shimutu mo benim bla yole mutu mo nagano munaku. No ni munaku mu nyema yodasi.
Okay. Onaku.
Minaku. Aga nege lane efe mene nuku. Alo efe mene, alo mene neke, alo lane noji mene mo neke neke fe neke.
Okay.
Minaku wonwa minyema yodasi aga nege nuku.
Well, he says that he has not seen, I was asking him what he said of the coronavirus. He said he's not seen anyone infected with the virus, and so he cannot attest to its existence. Interesting.
Well, now, what we are when we are not know you. We're going to take person. Bi anele nwe abo le nwe eni wo feel like won ya won ba won no da nmele nwe asuo we je eni aka we ba je nwe yin kula
no chon bi ene
yin ya okula o ke abaye le ne ekole enine kan na ganu tumo ni yese be ekọ eni ke je aba jam enyu aba ofa na ba nu an je le square wo ba smo sibi ele wonye.
Okay. Well, it shifted the conversation into the construction of the harbor. He's saying that this place is not the best for them. They've been relocated here, and he doesn't think that this is the best place for them. He thinks that a lot can be done, to better their lives. But he says that the conditions here really are not the best. Thank you so much. Cushion. Oh. Coronavirus, so we don't have to shake hands. Yeah. Cushion, where's the cushion? Show me. Okay, so what? This is what you sleep on every day?
Oh, man, tablet.
So this is what you sleep on every day? Every day you do what? Every day you sleep here?
Every backer beer war. Every backer every night.
Wait, every night you do what?
They sleep here.
Okay.
Our brothers.
Okay. Are they fishermen? Why do they sleep here?
Sometimes fishermen to stay here to sleep, but many people go out. Maybe Asian, or I can't be Asian. Show me come. Sani nuchu moka onye. Ona moka akwa ensure na abu. Koni ona no arrest. Ona ni. E wo bia na wo nye menu wo bia. Amesaji na me come on ni. Bu ave ka tu wo ba bia na wo te Asian ni no confit here. Amalu jofuki na me asa na dani bubaba. Bona.
Okay, sure. Thank you very much for talking to us. Okay, now let's get closer to the other part. Come, let's talk. Let's get closer to the ocean. There are a lot of fishermen, here going about their normal duties. You can see there's a lot of activity going on, different things going on. They're leading me to where the fishermen are. We want to speak to them. Hello, what's up? Miniano. Okay, yeah.
Joy News. What's up?
Yeah, Joy News. Nothing much. How are you doing?
What is going on?
Nothing much. We're just checking some few things. You've heard of coronavirus?
Coronavirus. Wale la ni o mami. Towo. Akwana jaje wa e manu. Wale chena. Wana ska wa kabale wa bike wa ngame. Aka coronavirus. Mini virus noni. Wana kwekoda. Ka we abake social distance. Mini distance no. Minister, ni o kpama ikem. Ona ensure na bia ne wafe slow because wana noko ni yano. Always yeah. Keke ma we bluffo e. Ona.
I enjoyed your English, so you speak English with me.
I should speak English.
Yeah, I enjoyed your English, so speaking. This is Joy News, so kindly speak English.
Joy News.
Yeah.
So I should speak English. I will speak Gan.
Okay.
One way Gan.
Okay. Thank you. Thank you very much for speaking to us. Who else want to talk to me? Hope all is well. Hope all is well with you guys. Okay, mini ya no coronavirus ne ba nyanu.
I'm sure that you're sure like a baby. I go watch the she know about beer or she. When I go to the cry, I'm Baba Kumobia, no canoe, 2 hours. I got coronavirus. I got money, I got boy, and I could become a cool. Now, I'm not Kumobia in my water. No coffee, I'm not 3 hours. Canoe,
I mentioned that we'll be talking about 2 things, coronavirus, and then also the relocation of the people at the other side to, this place. But surprisingly, all of them are, interested in the construction of the harbor. What many of them are saying is that it has brought along some difficulties for them because they have been relocated here. But I mean, if you speak to the experts, if you speak to people who are seeing the future of that project, they'll tell you that it is for the betterment of the people here. We are told that when that harbor is, when they're done constructing that harbor, they would have storage facilities, there will be schools, there will be recreational facilities and all of that. So really, I've heard some people saying that it is better they endure the hardship now so they can enjoy, later. But earlier, what we are showing you is the field, here along where these people live. And we are told that some of this came actually from the ocean. Some of it also came from, domestic chores here as a result of the activities here along the coastline. So this is not the best. But let's get closer to the seaside. Let's see. Let's get closer to the ocean. Let's see what is happening there. What do you have in there? What's in there? What's that? Oh, fish. You got it this morning? Okay. One binya keshi. Biani nyeba here. Tenya na biana ten. Biana shita mote yo ten.
Okay. Ni balaga shi. Pako wa ba biana. Wana go month. No pako wa kwa keshi biana ko wa ba yin lo yin. Wa kwa nu ni ba anu.
Pako nyan kwa no ni ya no ya biana.
Aga shi wana go month. Yeah, aga shi dele mi ka ga bo ba eku. Sani okwaje nshikamo ka ta 1 month. Onu mishi. Yeah, she wa kwa ko no pako wa kwa. Ni ni we balaga shi ni amefe she so fi o. Aga shi ka di wole yawo. Mi aka me ba eku. Sani anya fe na kani ojogba ni kaji nutumu ni etuni ya jeme ni meni ka nutumu ni etu ni mi sha anya fe mi ni aba shini ame fe sheso ame fi o
ya mi ni oton ni na fe bi
le ni ji abo na me ka ame fe ko le na hawo oni ame bo mo de sheso fi o ya ka shi lele ka ya ka tone ka ni bi e jala wa Jesu muskani
no ton ka me wo no iso ba den ba gba ni
no ko ni ka shi le bi de che ya mi yi lele nyo so na ama tenu ka je enu mo ni nya me se gun ame nu ti mo ni yin wa fe mi ni e ba pata
nyanta ni awo no ona
won pa fai no nu pa ni tamanu ni ame ko mo bi anu ame na o mo bo na ame fe ni ojogba ja ke si wo te me ko me what can say go on na nutumo also mo no won you fear me also
okay so just to explain what he was talking about so when they moved here to do their fishing here, this raised platform this platform here was constructed so they can safely put their boats and other things here. It is to prevent the ocean from getting closer to their boats. But he is complaining, the gentleman who I spoke to earlier is complaining about the low level of the platform that has been constructed. He thinks it has to go up so that when the tides when it's high tide, here, their boats will still be protected and their boats will still be safe. He was talking about how some of their boats were washed away, this morning. But now we're getting closer to the coastline, and there's a lot of activity, happening here. You would not know that it's morning. Oh, no, I want us to talk to the fishermen there. Okay. So there's a lot of fishing activity going on here this morning. No, come on,
bien tonné, no jinoni wo ba pe bien we ofin wo ba bien je no ni mi ma ke bo agbene bo lencho na ko ime. No to enu wo yo bien le wo na ko beni ensure e ba nye efite ne wo no ko ba fite. Si bien tonné wo fin wo ba bien no pa yo wa fa ya ke jina gan be po ba she ensure ba fite na wo mobo aga ke wo nu chumo ni no nye bi ejala wa. Mo ko eni no ni kan bien e property ni ke ko e family. No ke na kan ni je de pe a property fan here patan no be to ne do no you on man be fan na akwe na sale.
Okay, so I mean, going around here, the main thing we're hearing from the people here is about the platform. They want it to be raised. They want a higher platform because they think their boats are still not safe here, and that is what we get from a lot of the people here. Even when we're talking about coronavirus, they want to talk about the bread and butter issues. The things that affect things that. Okay, let's.
Ona inshallah akoba bi ene e wa ko meto ne ke we against now na ka afiabo no na ka afiabo sana chanu ya hie fio chuna afi kuma bi ene oba ne won pi e wa o wo mro sana afi mo bi ene sana kwa chanu e kan ya fio na e ya no ete fio sana kwa eto abasa nto mo sana kwa eto abasa nto mo ete alo edwe chanu ne shege.
It's the same issue about the platform here. They want it extended into the ocean. They want their boats protected and all of that. But, in Babiane, I've realized that nobody's wearing masks. Mukmoko wore mask.
Mask, what you about for? Offend mask. Mo fe mo mask. Sinu waje oba no te show here about for. Me can show te mi onyobu. Ona. Mo offend what je mask here. Ko ba ahia e ka bu ke wo.
Well, so I was asking him about their face masks. What we observed is that quite a number of people here are not wearing their face masks. And I was asking him where their face masks are, and he was telling me that when they go to sea, well, they're on the ocean, it would get wet, so that's why they remove it and put it in their pocket. So that's his explanation. But what we have observed here, quite a number of the people here are not wearing face masks. So really, that is what is happening here at Jamestown. It looks fun. A lot of activities going on. A lot of people here. Over to you in the studio.
Well, since the news broke the last week, it's been ongoing. The police have since started investigations, a number of arrests made, and it's about the lynching of the 90-year-old woman that took place in northern Ghana. But it is so far an issue that has generated wider controversy. Now, let's get the latest update as we go to Isaac Nonya, who is a regional correspondent there, and give us the latest update. And Isaac, we're getting the insight into what the police have been doing so far. And what's the latest you're getting from the stables of the police?
Well, there are two issues here. Yesterday, based on the additional arrest the police made, about 5 people, they were able to take their statement and they detained them. While the chief who was arrested first, Zakaria Yahya, was released to go. Yesterday, a combined police and military team also invaded Kafaba. Surprisingly enough, between 4 and 5 a.m., there was not a single soul, whether the aged or the young, in Kafaba. And that was something that was surprising to the security team, because going there at that time, they could not even locate a single person, meaning either they have a pre-information or they already left town. But what is known in the public is that many of these people have left town, but not to the extent that the aged and the children have also joined the queue to flee.
Before we come on air, we had some phone interaction, and we're expecting to have him for the commander of the area, and he said that he had given out some information about some latest arrests that have been made. Can you give us those details?
Sure. There's supposed to be 6 people. The upon interrogation, there's a circle of 5 people. And these 5 people, the assemblyman of the area, Kafaba number 2, is included. There are Haruna Anas, 34 years. Isifa Tanko, 35. Shaibu Mutala, 29. Suleimana Ali, 35. And Isifa Zakibu, 32. These were the young men that surrendered themselves yesterday based on the information that were given by the chief. Their names were mentioned, and when they came, they were in the escort of the 4 CIDs who arrived, CID officers who arrived from Accra, and then the East Gonja Municipal Police Command. So upon interrogation, according to the commander, there was a need for them to detain them and to do further investigation. That's why they're on detention now. As we speak, the chief who also left town, left Damago yesterday, we are told did not reach Kafaba, because Kafaba now is a deserted area and the security zone for everybody. And they are all living in stretches, mostly in Salaga and Tambale.
But so far, there have been no big conclusion yet. All these 5 people are suspects. We have to clarify, right?
Sure. They're all suspects. Nobody is found culpable at the moment.
Just about a day or 2 or 3 ago, the president said he was contributing to a fund, and I'm sure they now have a foundation that has publicly been announced. Of course, we've had the son of the victim who has since passed on, also raising issues about non-consultation before the setting up of some of these fundraising and also foundation platforms. How far-reaching has this been done in terms of the interaction with the family?
Well, Roland, within Gonjaland, the region, there are a lot of controversies and questions surrounding the so-called fund set, excuse my language, because sources within RESEC here in Savannah region are indicating that the announcement of the fund at the Deba ground, where the president was there, was an afterthought because it was not discussed at either RESEC or the Regional Coordinating Council. It could be that 1 or 2 people took the decision. But one, if you try to know, it's true that the family was not consulted based on our investigations, and the son of the deceased is coming out with these issues or cautions or concerns. Now, if you ask yourself, the fund was set up in consultation with who? Who are those managing the fund? What is the seed capital of the fund? How is it going to be disbursed? And for what extension? These are some of the questions that people are asking to know.
Okay.
And the RESEC chairman, who's the regional minister, is not forthcoming with the answers.
Okay. Well, thank you very much. Isaac Nonya is a Savannah region correspondent. A great insight that you've given us this morning. And we wish you the best for the day, Isaac. But that's it. The latest as far as the investigations are underway by the Ghana Police Service. And it's about the sad or tragic lynching of the 90-year-old woman. But well, we'll bring you all the latest updates subsequently on programming right here on the channel for the day. But we have to take a break. When we come back, we do have Kadi with the latest in showbiz.
Good morning, I'm Kadi and you're welcome to the showbiz segment right here on the AM show. Now, radio personality Doreen Ando was interviewed by Angie Dusty on Daybreak Hits, and guess what? She shared her broken heart experience. Watch this.
I've been broken hearted.
I'm human, Charlie. Whatever.
Hey, that the person be hard guy. The person be hard guy.
No, it's not a case of who is that fool. Who are those fools?
You've enjoyed broken hearts.
Oh, but I'm human, I'm female. And so, you know, people will walk over you. People will tell you stuff that you don't want to hear. But that is life.
Why didn't your no-nonsense side come out then? Or because you love them, you decided to just let them go escape?
It's not a case of no nonsense, but sometimes when, you know, it's I see it as it's a relationship. If the person doesn't want to be with you
any longer,
you can't insult the person, and you can't. I mean,
it's a total no-no.
Yeah.
Don't even do it. Just walk away. Let him walk away. Live, you know.
But what was the experience? Okay, what did you do to merit it?
It's not a case of what I did. It was what he wanted.
Mm.
I mean, if he didn't want to be in a relationship with me, what should I do? I can't do anything.
Hey, be hard guy.
No, it is not a case of he be hard guy.
Was it that you couldn't handle your fame at the time?
It is not a case of my fame per se, but if I wasn't the kind of person that he wanted to be with, I mean, I can't change that.
You know, some partners are a bit competitive. I don't know whether you know.
It's true, it's true.
Yes, which shouldn't be.
Yeah.
Yeah, and when they
exists
notice
too.
that you're overshadowing them, then they start pulling away.
Mm.
And for me, that's not love. I don't know.
Yeah. I mean,
it happens to a lot of people.
Yeah, it does happen. And
that's why I was asking about whether maybe you couldn't handle the fame. Maybe you go out together, Doreen.
Oh, it didn't have anything to do with fame.
Oh, okay.
Absolutely nothing to do
All
with
right.
fame.
Okay.
No.
Because I'm wondering what about you that will make that guy want to backslide.
Oh, well.
I'm still wondering.
Myself. Because I've been looking at her.
You see, I wondered too, but now I've moved on so much so that I don't even wonder anymore, you know? So it happens. We're all human, and it would definitely happen. So it's okay. It's okay.
So when you look back and you see them, are they happy?
Are you in my head?
Well, maybe they are not happy, but they will show it.
Because those is a Queen D maintain.
Yeah, they are not happy, but they will show it. They'll be like, oh, hello, how are you? Meanwhile,
because Charlie, guys, there are a lot of decisions that we've taken that we've regretted, but Charlie, it's difficult to go back, and you know what I mean.
Well, did he try coming back?
No.
When Philly cry.
Oh, David, say, be me teach you, me too,
or maybe she shut the doors completely and put a padlock on.
Well, it could be.
Hey, I mean, like I said, I probably didn't come here this morning to come and analyze that particular situation. I have so moved on. I don't even think about it. It's not my cup of tea.